Tell me what you see when you look at me. Do you see another brother lost in these streets looking for his soul?
Trying to find my soul.
Or do you see another brother searching for lost souls in these streets? A street soldier.
Street soldier.
Here to help you get that chip off your shoulder, warm your colder days and sober your drunken ways, and find a way to help you get over these hurdles placed in our path. And this is not meant to amuse you. This is for all those who have questions but are afraid to ask.
I won't be afraid. I won't be afraid. No. When times get hard, you lose your way. Open your mind and hear what I say.
This is a message for the hard and the soft. To those who tune in weekly and to those who keep an eye out for 8 p.m. on Sundays and turn their radios off. The truth hurts. The cloth has been pulled. We're walking around half dead. Use this show as your IV. Alive and Free is a new movement. We've achieved self-destruction. A street soldier promotes self-improvement.
Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah. Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah.
Tonight, however, is about COVID and the vaccines. Welcome back to, I got a hoodie on, you got a tie on. If I had known that, hey, Dr. Andre Campbell, welcome back once again. You're looking good. I don't know, did you go to virtual church or the real church?
Oh, no,
or what?
I figured I would dress up respectable to be on your program tonight.
Oh my God. I don't know if this
Thank
is a
you so much.
show. You look great.
Thank you for having me in. How are you?
Hey, Dr.
Good to see
Campbell.
you again. Good to see you again, man. And thank you once again, especially on Easter. Thank you once again. But I know you're a doc. You're a doc. You're a real doc. And
well, you're a doctor too, but you're just a different kind of doctor.
He doesn't do blood like that.
So let's just get right into this. I just want to tell you, Dr. Campbell, that I put this out to folks, and the way I put it out was that you would, and in fact, you saw the little flyer we put together, that the latest information, the latest updates, and I shouldn't have said all, but I did. All questions and concerns answered. And I also told folks, if you can't tune in, send me questions. I got 3 pages of questions. So if your water, if your water's not near, you may have to get it, because you're gonna be doing a lot of talking tonight, because people, and I thought the questions were great. The last CRM, the vaccines had not yet been rolled out. So this is a snapshot in time. So let's begin by saying, just give us a summary of where we are, right now with COVID, and particularly with the vaccines.
So thanks again for having me. It's great to see you guys again, and happy to answer any all questions you have this evening. So the first thing I want to say is that we're sort of at a key point in the pandemic. So started, last year in March, February timeframe. So we're 13 months in. We have 555,000 deaths. There are over 30 million cases in the United States. In San Francisco, we've had roughly about, so somewhere like 15,000 cases, 20,000 cases, and we've had about 500 deaths. California has had somewhere in the order of 3.7 million cases and 59,000, 60,000 deaths. So that's kind of the grim reality of having a pandemic. On the flip side, we now have a national policy on how to get us out of this, so that we are now vaccinating 4 million people a day. which is
Mm.
just unbelievably amazing. And we
Mm.
went something like 800,000 a day, 600,000 a day under the previous administration to now 4 million a day. So we're trying to vaccinate our way out of the pandemic. So
Mhm.
what is happening now is there are 20 states where things are increasing, and that's because these variants are beginning to take hold. But the good news is that the vaccines, as far as we know, the Pfizer, which is the one I took, and it was, I just had a little soreness in my arm for 1 and 2, didn't have anything else. But some people have had, second time they've had fevers, they had chills, they had stuff. But these are all things that go along with taking the vaccine. We've now given 1 million vaccines in the United States. So about 16% of people have been totally vaccinated. That's
Okay.
the number in the United States. So each state is a little bit different. New Mexico is probably, they've vaccinated 20% of their people there. We
Mm.
vaccinated about 16%. That's about the average for most states around the United States. So that's kind of good news. We have 3 vaccines, right? One is Pfizer, second one is Moderna, which everybody knows about. And then we have the Johnson & Johnson, which is a 1 shot and done. So we've given 1 million vaccines, no major side effects, and nobody has died from the vaccine. We've had a lot of people die from not getting the vaccine and having COVID, which is 550,000 people, but nobody after getting it. So it is 95% effective. So the truth is you can still get it after you're vaccinated, but you won't go to the hospital and you won't die. And that's really what we want. So the purpose of this is getting the word out. It's safe. It is something that anybody could take right now who are 16 above. They're doing work now on teenagers, and it looks like it's suggestive of teenagers, and they're very young, right, to see. But they've given it to pregnant women, people with cancer. Pretty much every major group has gotten it and not had any major side effects. So that's really kind of the thing. We have to lay our fears. Now, there is a narrative out there that people of color are not wanting to take the vaccine, and there's some vaccine hesitancy. But the reality is, they actually just came out with a study, and it says that the number among African American and Latin people is about 20% of people 25 are saying that they may not take it or don't want to take it. But the number among white Republican men is about 45% or 50%. So we're going to try to get to 70% of people then getting vaccinated, so we get to this herd immunity thing. We're going to have to basically convince a lot of people. Most of the barriers to Black folks and people of color, Latin people, has been related to access. So not enough access. So if you give people the chance to get it, like my friends in Philadelphia and folks here, the Ujima group have done where they've taken it out in the community and done it. And Malcolm John, who's a infectious disease doctor, has partnered with folks in the churches in San Francisco. All these folks have actually gone out there and they've been given hundreds of vaccines, thousands of vaccines to people. So if you get to where people live and you give them a chance, you explain to them that this thing is safe, it's a way to get out of this thing, because we all want to get out of this thing. Everybody's getting tired of wearing masks and doing this stuff, but what we have to do to get out of it, this is what we have to do. So that's, I wanted to just kind of start with that, and then I'll see if you have questions what I said, and then maybe we can answer any other questions that you guys have. Sounds like you got 3 pages of questions to ask.
Oh, and people are already in the chat room. So let's give you an update on the people that you see right here. So
Yep.
Vaccinated, count me toward the 70%, 77%, but 2 Modernas, done, 1 down. You scratched me off your list, Dr. Campbell. I wanted to say that first.
Congratulations.
And everybody stay where you are.
Don't you feel good that you have been vaccinated? There's something liberating about being fully vaccinated. It's fantastic.
Well, I feel wonderful. I mean, and I'll get to what that means later. You can tell us more about what you can and can't do, but let's get a check-in with here. So I got Moderna. The Soul, why don't you talk about you, Soul?
How you doing, Dr. Campbell?
Hey,
Thanks for coming on again. Nice to see you.
Thank you for having me. Great to see you again.
Last time you were on, I was on the fence about getting the vaccine, for various reasons. I figured I would, but I wasn't committed to getting it. Well, opportunity came up. I signed up. They said, "Oh, Mr. Marshall, you can come down in an hour." I said, "I can't turn that down."
Of course.
I did my research, and I decided I was going to go with the Johnson & Johnson. That was the first day that Johnson & Johnson had got to Contra Costa County. I'm here in Richmond. I went to the auditorium. I said, can I get J&J? They said, that's all we have. So you're going to get it. I got the shot, and they had me wait in the waiting room for 15 minutes. I was like, okay, I'm good. I'm going to be all right. And then nighttime came, doc, it wasn't good. I was down in the bed, shaking, shivering like a little baby, sweating.
Yep.
And it was like that for about 2 to 3 days. Now, some people said, oh, it'll be one day. For me, it wasn't one day. It was 2 nights with the chills and the fever. And then 3 to 4 just with aches. And I don't mean the arm. I mean just body ache. I felt like I was sick. And I wasn't particularly happy at that moment. Once I got about the 4th day, my energy, and it was funny real quick, Doc, because it was my anniversary, with a woman I'm dating, and we supposed to have an anniversary dinner. And I knew I had the vaccine and I knew I wasn't feeling good, but I tried to go out to dinner anyway. And then we got to the dinner and it was outdoor seating and I was in a bad mood and it just ruined the whole anniversary, Doc. But anyway.
I'm sorry. I didn't mean to do that to you, right? But
but once I got to day 4, my energy started coming back. And then I was so happy that I was vaccinated. I got the 1 shot. It was over. I'm still wearing my mask. I'm not, thinking that I don't have anything to worry about, but it does feel really good to know that, because I was someone that wasn't sure. And even when I sat down and they were about to put it in my arm, I almost jumped out of the chair and ran out. I mean, I'm that kind of person. So I did it and it feels great now. Anyway.
First of all, congratulations. Now, I told you that there are people who have reactions that you have. Most people, it's usually a day. Yours is a little bit unusual that it's more than 1 day, right? So, but we learn things about the vaccine because, what it does is it tricks your body into thinking it may have the body has been exposed to it. And what it actually means is that, I know you felt terrible, but it means that your body is learning how to respond to the virus when it actually comes. So, for you, it was a little bit different. So it's more days than usual, but I got to say, congratulations. That you're vaccinated. You only got 1 and done. You're lucky. Unlike the rest of us, you had to take 2, right? You're 1 and done, right? So you're done with it. Congratulations.
Well, I want to thank you personally though, because your information played a big role.
Well, thank you so much, and I appreciate you doing that, because that is really that's where we got to get the message is that you may have the side effects you had is nothing compared to actually getting COVID or being a long hauler or dying from it. When you start knowing people who died, and some of you may know people who died from it, and that will not happen to you now that you're vaccinated, and you're not going to go to the hospital. I mean, that's why you only have 7 people in a hospital in San Francisco, with COVID.
Wow, that's tremendous.
I mean, that's
okay.
Hard.
Well, that's Malcolm. That's me, Lady E.
Hi, good evening, Dr. Campbell. It's great to have you back again. I just got my 2nd shot on Thursday.
Okay.
So Thursday I was fine. I got it around noon. Probably around 10 o'clock, I started, maybe around 8, 7. I don't know. I started getting chills, but I was okay. Not chills. By the time I got around 10 o'clock, I was kind of cold. Friday, that was just the other day. Okay, just the other day. Somebody sent me a message saying Happy Resurrection Day. I said, I'm trying to rise up from these symptoms from this shot.
Yeah.
Friday, I had chills, aching all over, fever. I had every symptom that they said you could have all day, 24 hours. It wasn't just like a spell.
Yep.
It was all day, all night. Saturday, I had fever. The chills were pretty much gone by Saturday afternoon, and the aches were not as intense by Saturday afternoon. And so today I've got the leftovers from all that, because how it makes you feel. There's like this whole thing, the nausea, the headache, just the lousy, bad
Yep.
feeling. So I'm waiting for that to be over.
Oh,
And there's
that's
no
cool. You
energy.
took Moderna, you took Pfizer. Which one did you take?
Moderna.
Okay.
And then my energy is like, if I spend 15 minutes doing something, it takes me 30 minutes to recover. Yeah, I'm exhausted.
Yeah, that is usually it's the day after, people get it. I mean, I did something that was really dumb. The day after I took my first one, actually the day I took my first one, I spent the whole night on call, and that was at work, which was
Yeah,
wonderful.
that's
But I felt fine, right? And then the second one, I said, well, maybe I'll take the next day off. So I take it, and the next day I stayed home, and everything was all right. So it was, but so that's just me. So some people have it like that, and some
everybody's
people
different.
do have it where they have a reaction, and that's just your body sort of getting revved up. I mean, it's you're trying to get the immune system that you have revved up, and that's why you have these responses. And it's nothing bad. It's understandable. When you read the fine print, it says you can have muscle aches, you can have
Yeah.
nausea, you can have headaches, you can have joint, you can have fever, you can have all that. And some people have it for 24 hours, some people have it for a little bit more, but it'll go away. And so, but it means again that you have been successfully vaccinated. And so now some
But it
people usually get it
impacted
one
my
second.
appetite. Is it supposed to affect your appetite as well?
That too, yes, that can happen. Yeah, because you won't feel totally normal, but it'll go away. Now it's usually after the second one that people have the big responses like you had and with Malcolm, and that's usually like the second dose. That's when people have, because that means you've been primed, and then what happens is the second time it comes back and it's like, okay, we're going to really give it to you, and
Yeah,
that's
well, it
when
did.
you have the response. So it's the
I
second
got it.
yeah, people had it. So you have proved the theory that your immune system works.
Hallelujah.
It's
Now,
turned
can I
out.
say this to you? I was glad for my experience because, I mean, obviously I was glad I got vaccinated, but I feel like I learned more.
Yep.
One is that we're all different. Our bodies are different. Our situations are
Everybody-
different. And, I guess what I'm saying is we need to get vaccinated, but I thought sometimes people were oversimplifying, saying, oh, it's no problem. You'll be fine. Don't worry about it at all.
Well, that's not,
And while it wasn't something to worry about, I did get sick, and so I think there's some in the messaging. It's okay to say, yeah, you might be down for a couple days. You might not, but if you are, it's okay. And then after that, it'll be great. Does that make sense?
don't want to be scheduling regular stuff because you don't know what group of person you're going to be, what group you're going to be in. You don't know if you're going to be like and not feel anything other than a sore arm, or you're going to have what you guys had, right? So you just have to make sure that you time it exactly. So you get it later in the week, so you get the weekend to recover, so that you feel better by the next week. So those are ways to work around it. But you got to be honest with people. It's like, this is going to take you on a journey. I mean, there's an emotional journey that you have because you're going to feel you have to, first of all, you have to understand that you're going to take this thing and it's going to make you better, or make you fight the pandemic so we can get out of it. So you got to get over that. And apprehension, it's normal to have apprehension and think about things, read about things, think about things. So then that's the emotional thing. And then there's the physical thing that happens after you take the shot, because then your body takes over with doing things. So some people said you should probably take a little Tylenol after the second one. That may make you feel it better. Than other people argue that, well, maybe you shouldn't take Tylenol because maybe that may interrupt the impact on it. But I said if the Tylenol makes you feel better, that's probably okay.
And I guess it's interesting because I have heard, I thought my second shot was going to be worse than it was, because I had heard that, it could be. And I had the rough, I think I got on a Saturday, and I had the, some stuff on Sunday and Monday. I was, it was, I was fine. I was fine and happy that I had taken it. And so, yeah, everybody's experience probably going to be different. But the main thing, I think, maybe still, eventually when this is through, we'll probably feel like, yeah, I got it. I got vaccinated. It's done. I'm counted. Let me just ask, what can you, a lot of question is, what does fully vaccinated mean? What can you do? What can't you do? I mean, just say that. I mean, everything is said, still wear the mask, still wear this, but I heard the 95%, but what does that
So fully vaccinated means that you've had one vaccine, you had a second vaccine, and 2 or 3 weeks later, you are considered fully vaccinated. So that is what fully vaccinated means. So the CDC is adjusting recommendations about what to do, when to do it. Of course, they say, you can travel, but you got to wear a mask, right? You should probably not travel though if you don't have to. There's still kind of like in between. You can have groups of meetings unmasked with another family that in small groups, like 2 to 4 people without a mask. If they've been fully vaccinated, you've been fully vaccinated. So that's why you see these reunions of grandparents and their grandkids they haven't seen in a year, with doing things, because that's actually what is now allowable. Because if you've been vaccinated, fully vaccinated, grandparents and you and your kids are obviously healthy and not having any problems, you can actually visit with them because it's safe to do that, right? So but it's just small groups. So we're in the orange tier now. If you read the site from the Department of Public Health in San Francisco, it says it could be small meetings with people, but they want you to be masked. Only 2 or 3 households, maybe up to groups of 20 people or so, but they want social distancing, masking, hand washing, all that stuff. So you can do a little bit more. I mean, I'm not, I miss dining out and doing all that stuff, but I don't think we're quite ready to dine inside a restaurant at full capacity. So the problem we have is this: is we have there's one federal message, CDC, the White House: wear a mask, take care, watch out, because you wear the mask for everybody right now until we're fully vaccinated. Because if we keep going at 4 million a day for 30 days, we're going to have 120 million people vaccinated, in addition to the 100 million that we have right now. Right, so we're going to be into the 220 million numbers of people to be vaccinated. So in May to June, that looks like things will be like, if we can get to that number, we're actually going to be in pretty decent shape, better than we are right now with doing things. The problem is that, of course, spring break happened. Florida, I was mortified when I saw that stuff going on in Florida.
Yeah.
They're like, take off your mask, do what you have. This thing is all over. And I was like,
well, those folks aren't vaccinated. There's a spring break folks, young people that aren't. Is that the group you're talking about?
Yeah. So what's happening now is there's a surge in Michigan, and you probably heard about that, and maybe 20 other states. And now it's people under 40. So it's young people who are spreading things to each other. So we're still waiting to see what's going to happen when Florida after the spring break, because nobody was wearing a mask down there. They had hundreds of thousands of people down there. I was kind of mortified when I saw all that stuff that's going on, because that's exactly what's the wrong thing to do right now. This thing is not over. Younger people may have less severe disease, but they can spread the disease to older people. And that's what the problem is. So the variants are taking hold. The variants are they're much more infectious than the baseline virus. Again, the viruses are built to mutate. They're built to mutate, so that one person gets it, mutates again. But so right now, the vaccines that are available here, they work against the South African variant, the British variant, the California variant. They work to keep people out of the hospital and people getting sick. Now, the other thing that's going on, Brazil is on fire right now. There are 3,000 people dying a day. And eventually what's going to happen is, once we get ourselves fully vaccinated, because we're a bit of a mess, right? Once we get ourselves out of this mess, right, then we got to help the rest of the world, because the rest of the world got to be vaccinated too. India is on fire. They're having 100,000 cases a day that just, reported. And we're not testing enough people now. We've been testing less people, but we still have 60,000 people a day getting the virus. So it came down to about 50,000. And now it's going up again to 50 to 60,000. So that's why people talk about this fourth wave coming. The wave after Christmas was just absolutely terrible. I mean, it was actually worse than anything that happened last March, April, through the summer and October. This wave after Christmas was just terrible. I mean, there was huge numbers of people in the hospital, 120, 130,000 people in the hospital. Right now, there are 40,000 people in the hospital with COVID. So this thing is not going away. And there's about 1,000 people still dying a day. So it's still not going away. I mean, it's here. And so we have to kind of protect ourselves. So, wearing the mask, social distancing, being very careful, when you're doing things, getting as many people vaccinated. We're in a race. We're in a race to vaccinate as many people as possible so that the variants don't keep a hold. If we vaccinate our way out of this, then what will happen is the things that are happening in Israel, where things are kind of getting back to normal, things in other places where, in Australia, it's like it doesn't even exist, right? Because everybody's walking around without a mask because everything is fine, right? They have 4 cases in Melbourne, and they shut the whole place down, right? Melbourne, Australia's got it, and New Zealand is like living normal living, right? Because nobody gets it there, right? So there's a way to control this thing, and we've not been doing it just until recently. So last 70 days, we had a new administration. We're doing a much better job of messaging, getting the word out, doing what we have to do with that. People now, kids are getting back into school. So we're kind of beginning to have some normalcy, but we can't race. Anytime I see a big group of people, I really worry about it.
So
Because-
Doc, I'm sorry, just let me get clear on what vaccinated people can do with vaccinated people, because that's, I think, when people get vaccinated, yeah, I got to wear a mask. I mean, I think people are saying, yeah, I'm heeding to that when I go out and wear a mask, but what is it now that vaccinated people can do with vaccinated people? They're safe, but what's the recommendation?
Small groups of people,
Uh-huh.
2 different households. If they're fully vaccinated, that means
Yeah.
vaccinated, 2 vaccines for the Pfizer and Moderna. 2
Right.
to 3 weeks later, they're fully vaccinated. One household can meet each other, right, unmasked in that situation, right?
Okay.
Right. So that's that. But it's really small groups. It's not like you can go out and have a gigantic party, right?
Right.
Because the more people you have, is the more you introduce the fact that they're not people not vaccinated. But everybody has to be fully vaccinated in order for you to invoke that.
Okay.
The more you can basically, like, let's say one household, known household, fully vaccinated. 2 or 3 weeks later, you can have a meeting safely without a mask, right? But
Got it.
if you got bigger groups, you got to wear the mask and do stuff. So because you got to do it. So if you have more people, you're gonna have to wear a mask because you don't know. We had we had a meeting last week or 2 weeks ago. Everybody was fully vaccinated, and everybody else took off a mask except for me. Right?
I'm with you, Dr. Campbell.
So I said, you could do that.
I'm with you, baby, because of that one day, that them 24 hours, I don't care how many shots you got.
Yeah,
Well,
Stay away from me, and I'm wearing my mask, okay? But I have to say that I know we got people who have questions, and I don't want to, as much,
there's a ton of questions that we, and they
Yeah.
gotta.
and I want to go right to the chat because we've got people who are lined up, looking forward to checking in with.
Yeah, but see, let me start with the ones I got, okay? And then
Okay.
we'll get to the chat. We got a ton of them, and some of them they already gave me first. So let me give the first one, and then we'll go. So this came from and by the way, we didn't talk about, we should have said the vaccinations are now moving down in age. It's starting to move forward, and so now this is a college student who was asking
16,
questions.
you can get it. Yeah. So over 16 on the 15th of April, anybody could get it in California.
Oh, okay, great. Okay. So this is a college student who was asking, which vaccine is the best to take? That was his question. So let me just start there.
So the official answer is take whatever you can get, right?
Okay.
Because
All right.
they all work superbly to keep you out of the hospital, keep from going to the ICU, keep you getting sick, right? So take whatever you can get. If you get the 1 shot, fine. 2 shot, Pfizer, Moderna. I took whatever came my way. So that's what you do, right? You walk in there, they have that. You just take whatever they have, and you will be protected. So then don't worry.
I will let him know that. There's
Yep.
another question. Are the vaccines, you just answered this one. This one is short. I think, are the vaccines effective against the new COVID strain?
Yes, right now, the preliminary data shows, and this can change, right, shows that they are effective against the variants, right? So they keep you out of the hospital, they keep you from dying. Right? That's what it is right now. So now the thing is that if we let up our guard, right, and we basically say, all right, we're just going to do whatever we want to do, that's when we're going to get into trouble, right? Because then it looks like it's going to be, it's off to the races with stuff, and we don't want that. We want to have everybody fully vaccinated as soon as possible.
All right, here's from a 17-year-old. And she asked, I was wondering if there have been any cases where individuals mix or match their vaccines, like Pfizer or Moderna, and if and how it may affect them. Is there any data on that? That was, I thought, an interesting question. So I want
take 1 Pfizer, 1 Moderna, right? So I have to say that I don't know the answer to that, right? I can know the answer from the studies show that you take one Moderna, you take second Moderna, take one,
Okay.
you take one Pfizer. I just read something today about they're talking about what that is, but there is no data that that says that that is a good idea right now, right? So just if you can sign, what'll happen is when you sign up for the first one, they'll give you the second one time, right? So
Right.
you don't have to jump to get the other one. You
Yeah.
just you go to the place, you get Pfizer, you get Moderna, and then you get the whole thing, or Johnson & Johnson, you're done, right? So those that's the way you should do it. Don't go shopping around. Just get one, and they'll sign you up, and they'll say, "Come back in 3 weeks and get that." That's what happened to me. I came back. I think that's probably what happened to you guys too.
Someone, again, this was a question, what percentage of the country has to be vaccinated for us to stop wearing masks, which I mean, get to herd immunity? And you said roughly 70%.
70% of people, right, where
All right.
it's sort of relatively normal. That's that herd immunity, thing. So it's gonna take some time to get there, but we're marching forward. I mean, that's 4 million a day. That's crazy. That's fantastic, right? You
Oh,
know,
wonderful. Wonderful.
that's like
Okay, and let's go to the chat room, and there's a bunch, and I actually, the same people may have sent me theirs, but that's okay. We'll go to the chat room. I still got 2 pages left, so let's take some of theirs,
let's go.
their questions, and let's go for it.
Dr. Wise is asking, in your medical opinion, Dr. Campbell, after receiving her vaccine, do you think it's okay to travel out of state?
Okay, so let's look at what the CDC says. The CDC says right now that you can actually travel safely out of state if you wear a mask, you social distance, and you keep your hands washed and all that stuff, right? That we all normally do, and you wear a mask, right? With that. Now, when you get to the place, right, if you're vaccinated, fully vaccinated, that means 2 vaccines, 2 or 3 weeks afterwards, we have antibodies and all that, right? You get there, you do your thing, and you don't actually have to quarantine when you come back, and you don't have to get tested if you're fully vaccinated. So that's the thing that the head of the Dr. Walensky said this week, is that you can actually go from one place to another safely now, right, and not have to quarantine in either place to get tested, because they had wanted you once you went out of state. I mean, they were talking about one point, you go up to Lake Tahoe, you got to come back, you got to get tested twice and make sure. But they're actually beginning to do away with that, because when you're fully vaccinated, right, you're okay, right? So that's what's going on now. There's all this discussion. I don't know, unfortunately, I don't know why things get so political, right? Right. The clear people and the people who do the global entry, they're talking about getting you a vaccine passport. To me, that makes total sense, right? If I can walk into someplace and be scanned, right, that means that I'm okay, right, right. And I think that makes a lot of sense. But there's now political discussion saying how bad it is, how people are going to be lepers. I mean, come on, like we're talking about public safety here, right? Now, if you want to get on a plane, you got to wear a mask now or they throw you off, right? Eventually they're going to say, if you want to get on a plane, maybe you should be vaccinated, right? So that other people don't have to worry about it, even though the circulation on the plane is okay. And there's been just a few cases of things documented on planes where people have been transmitted, but it's really on the other side, because the problem is that there's still a lot of people who don't believe that masks make a difference, but the masks do make a difference. They reduce the incidence of transmission significantly, and it just makes a lot of sense to do that. So if you travel, you will have to wear a mask. You don't have to get tested before and after, and you could do it now more safely than you did before. Now 1.5 million people are traveling now, which is a lot. That's a day by TSA standards, and that's not the normal. Normal's 2.5 million, but there's still a lot of people traveling right now.
All right, that is Dr. Wise's. And anybody else in the chat?
We do. So Mrs. Patterson says that she's been experiencing allergy type symptoms that are very similar to cold symptoms for the past month. She is scheduled to take her first vaccine this Tuesday. And will these symptoms affect the efficacy of the vaccine?
Right. So, I mean, the first thing is, I obviously don't know her, and it's hard to give medical advice without the person talking to the person. But the first thing is, you need to make sure you talk to your doctor, like tomorrow, and just say, listen, this is what's going on. I think it's just my regular allergy stuff, right? Am I okay to take it, right? And if your doctor says it's okay, then go ahead and do it, right? So you just want to make sure that it's safe for you, because everybody's a little bit different and they can have other comorbidities and all that stuff. And maybe if you have something else, that they tested you for, you know, you got to make sure you don't have that. So for me, I think I would talk to your doctor, make sure your doctor says it's okay. If they say it's okay, he or she says okay, then you can go ahead and take your vaccine. Otherwise, I would just sort of think twice about doing it if you're sick, right? Because they don't want you taking it if you're sick. So that's the real reason. That's what they need to rule out. That's what she needs to rule out.
That is good to know. That is really
Good for her to know.
Yeah, yeah.
That's kind of makes sense, because the doctor knows her. The doctor be able to do, to give her an idea of what's going on. So.
And then Mallory Branch would like to know about the mRNA. And is it true that they've been preparing for this vaccine for 10 years or longer, before COVID-19 even hit us last year, and why?
All right, so let's see. This is SARS-CoV-2. So there was SARS-CoV-1, and they were people working on it, including a black virologist who works at NIH, Dr. Kizzy. You probably heard about her. She worked on the Moderna virus, the vaccine. So they were working on this for a long time, just to see. I mean, so they kind of saw some of it coming, but the fact that they were able to turn around a vaccine in such a short period of time, looking at 6 to 7 months, get a test to get it through the FDA, it's pretty remarkable that they're able to do it. So I think that the fact is they knew that there was going to be, there's going to be a SARS-CoV-3, right? There'll be more, right? I mean, that's the one thing that you're going to have to realize, is that we're going to have more of these pandemics. And the fact is we're able to engineer this virus, this vaccine based on mRNA technology. So mRNA goes into cells, it basically tricks the cell that it got exposed, and then the cell then is able to fight off the virus, so the virus can't land on it. I mean, it's all about the virus landing on the cell and creating the infection, right? The virus basically gets on the cell, it takes control of the cell and mass produces, and that's how it makes you sick. And what happens, the virus gets in there and just says, well, you're not going to do that to me, because I'm going to change my configuration of my receptors outside the cell. And that's sort of how it works, right, to do it. So they've been thinking about this and knowing that it was going to come for a long time. I can't tell exactly when they started doing it, so I don't have the answer to that. But I can tell you that this is SARS-CoV-2 and that's SARS-CoV-1. So when the two had SARS-CoV-1, right, they knew that we were going to have more. So then they said, let's start working on technology to do that. So that's why NIH, National Institutes of Health, and other places started working on trying to figure out a way to get us immune to this. From this, because remember, there's viruses they've been working on for 40 years. HIV, they've been working on it for 40 years. They still don't have a virus and vaccines.
Right, that's right.
Just remember that, right? This is a miracle. What happened?
11 months, yeah.
Yep.
Here's one I had, and you can jump in whenever you're ready. Somebody asked, what is the main difference between the Johnson, the Moderna, and the Pfizer shots, or is there a difference?
The Pfizer and Moderna are mRNA vaccines, right? So there's one that uses a different vector. I can't remember if it's the AstraZeneca one, right, or the Johnson & Johnson one. They use an adenovirus vector, right, to sort of travel, that carries the message to the cells to sort of tell the cells to fight off. So that they work a little bit different. The Moderna and the Pfizer, they work the same way. Johnson, I'm not sure, but I think it's an adenovirus vehicle. So it means that it just has a slightly different mechanism of use. But the AstraZeneca one that's the fourth one that's coming down the pipe. That one I can't remember. Each one might have a slightly different approach to the same problem, but they work quite well.
I think you may have answered this. The same person asked, what results have studies shown since the populations have been getting the vaccine? So I think you said that you gave the number I think you gave was 16% of the population in the United States has got
16% have been fully vaccinated. That means they have 2 vaccines and are fully vaccinated. Right? So
that would be how many people roughly? And I'm
I think the number I saw that's 100 million people have been had one vaccine.
okay. 100.
And then 60% have been fully vaccinated. So 39% have roughly had one vaccine, and then 60
Right.
and 70% have been fully vaccinated.
Have they have and any results? I mean, I guess what he meant by results of nobody, percentage of reinfection maybe, or I mean, because nothing is 100%, but I guess he's looking for that kind of data about.
So it is too early to say what happens to people who get infected afterwards. There are reports of people. Remember, it's 95% effective. So that means 5% of people are going to get it, right?
95%. That's
So that means 5%. So there's going to be some people who will get it, but if you get it, you won't die from it or get sick from it, right? So it is effective in suppressing it, and then there's some people going to get it. So and the thing is that you have a much better chance of surviving and thriving afterwards if you have the virus vaccine, which is the message we got to get out to everybody. Get vaccinated as soon as you can, as quickly as you can, so we can get past this.
well, he asked this question just to follow this up, which don't even hazard an answer. But he says, when do you think things will get back to normal? So don't.
I don't know about that. I think
I know. So
somewhere in the fall. I mean, that's kind of what he's kind of the guru of this stuff. I mean, they're talking about sometime in the fall, maybe. But we have to make sure we vaccinate everybody. That includes all the school kids and everybody else when we do things. So we have to vaccinate everybody.
And you got any? Because I got one that I hadn't heard of, but a couple of people really. Well, okay, let me go with this one. This was, and I got this from and they were really serious about this. And when they said it to me, I understood. I don't know how this came about. I guess I don't know. Anyway, does the vaccine affect fertility? I've heard somebody asked me that. Does it affect fertility? Is there any link to birth defects or like autism and the vaccine? Have you heard anything?
So right now, we have no evidence that there is any thing like that happens. Actually, they recommend it for pregnant women, right, and anybody who should take it. So right now there's nothing in terms of autism. None of this stuff that this is the problem, is that in the United States there's a huge anti-vaxxer movement, right? So it started actually, it's interesting because one of the biggest counties in the whole country that is actually a vaccine is Marin County, right? And people say, well, this happened to my kid because they had this vaccine, and there is no connection between any vaccine and autism as far as we know, right? And there's no vaccine for this with respect to autism, infertility, or any impact on that right now that I know of, right? So I know that they're recommending it for pregnant women, and I've seen many pregnant women get it, both in other places. So they're giving it to pregnant women. They're giving it to people who have cancer. They're giving it to everybody. So I think if you give it to somebody who's immune suppressed, it shouldn't be a problem. Now, the long-term effects, right? Nobody knows because this vaccine is brand new, right? So, but what you're going to need to do is probably get a booster, right, to make sure you have enough antibodies, to fight it. But as far as I know, there's nothing reported, and there's no anticipated side effects with regard to fertility with respect to any of these vaccines.
Which leads to the next question in the chat, and that is, will the vaccine be required each year due to the different strains?
Well, they think right now that you have antibodies for at least 6 months, maybe longer after you get vaccinated. So 6 months is a fairly long time, but they may need to give you the booster, like you get boosters for other things from year to year when you take vaccination. So you're gonna have to take a booster most likely. And the companies right now are working on booster vaccines to be given out after they go through this whole wave of mass producing the vaccines.
So that means after 2 shots or 1 J&J, you come back in.
Yeah, 6 months to a year, probably something like that.
And get another 2 shots or another 1 or.
1 shot. It's going to be 1 shot. and it
Mm,
may be 6 months to a year afterwards. It's not going to be. They don't have to go through the whole series again because your body's been primed for it. All they have to do
I
is let
see.
you remember that you've been exposed to it.
So if someone's already had COVID,
Yes.
should they still get the vaccination?
Yeah, there's a protocol. If you've had COVID, what they do is I think they wait a couple months for you to recover. It's either 2 or 3 months. You recover, make sure you're fine, and then that's when they'll give it to you. But you should certainly have it if you had COVID, because there's probably 20 or 25% of people who've had COVID already.
Mm,
And if you add that on top of all the people getting vaccinated, we're moving closer to larger and larger numbers of people who who have been exposed or have antibodies, so that you can, but there are some people. There are case reports of in the in the world of something like 15 cases of somebody who actually had a second case of COVID
mm.
after they had it the first time. So that's why they're recommending that once you recover, once your immune system is okay, once your doctor says it's okay after a 2 or 3 month period that they give you the COVID vaccine.
Okay.
Go ahead, Missy. You want to say
The
something?
last, yeah, the last question in the chat was is it true that younger people are getting coronavirus at a higher rate?
Right now, that is the biggest number of people in that big surge in Michigan is people under 40 years old, and there's younger people. So
Ooh,
that's what's going on right now. That's the group that's
more?
yeah, right now. Right, that's what's going on now. Right, so it's the younger people who are getting it, and that the older people. They vaccinate something, and people above 75, they vaccinate something like 80% of them. People above 65 is more like 70%. There's a lot of people who've been maybe 80%. The older people, they've been vaccinating them. They were in the first group with doing things, but now eventually they got to come around to young people. But young people are getting it more now in the group, and that's who's getting sick from it right now. So people in their 20s, people in their 30s, who are young. So that's why we still have to be careful, because you still can transmit it,
Mm-hmm.
especially if you have a variant. You may not get it, but you give it. What they worry is that somebody who's 20, they're out partying, they give it to come home, they give it
Right.
to grandparents and what have you. So that's what they're worried about with that. So the next group, it looks like it's going to be younger people, and the variant is much more infectious than the other ones. The B1117 is the one that everybody's all nervous about, because that's the one that's the fastest growing one in the United States right now.
If I can return just a minute to the question about the vaccine and fertility and birth defect. I remember talking to the person that gave me it, and they were really concerned. I mean, I didn't ask them where they got this information, but I would have, and you have flatly said there's no evidence of that.
Right now,
Um,
nothing. There's nothing.
um, it would seem that for you as a doctor who was trying to get past this thing, what is this information? Have you seen where where this stuff comes from? Is it individual people? Is it, I mean, the internet, I already know how that thing works. Just, have you seen things sprout up like that or come up like that
There's all
make
these-
you as a doctor says, I don't know where they got this,
Yeah,
where this came from, but you could see that,
yeah,
you
that's
know, yeah, I'm just curious.
There's a lot of conspiracy theories and a lot of other theories that spring up on the internet, in the back of rooms, chat rooms, that kind of stuff. Facebook has been known to. Facebook's actually trying to do a better job policing things, but the internet has all kinds of stuff on there. Because I mean, that's the second person in a few days who asked me that question. I don't related to birth defects. The answer is no. Related to fertility, I think it's a little too early to say, but I don't think there's any evidence that's going to affect fertility right now. So I mean, what I could do is I could ask my friends who are experts in that area to see if they have any data on that. But I think it's too soon to know anything about that right now. So I could tell you that one thing: there's a lot of COVID babies that are being delivered right now, right? Because people have been at home, and there's a huge upswing in births after that, right? But I don't think there's, as far as I know, there's nothing that has been reported related to that in the official media, and I keep a close eye on the stuff that comes out from the CDC and so forth. I've not seen any of that stuff. Not to say that there may be something in the back of some chat room somewhere where somebody
Yeah.
says, you know, if you take this, you're going to be infertile and it's going to be the worst thing in the world. But I don't have any evidence that I know about that supports any impact on fertility.
Okay, thank you. Thank you. So one person in the Marshall Plan sent 5 questions. And I think you've actually covered a couple of these. And the first one was, and this is probably a little tough to answer, I don't think you have, but how many cases of adverse reactions to the magazines, to the magazine, boy, I can't read, to the vaccines? How many cases of adverse reactions to the vaccines, which is, I just, even for me, that's, what does adverse mean? And it depends on the individual. So I think that, you know, we can.
Yeah, it is, but let's just say nobody has died from this vaccine and 100 million people have gotten it. Number one. Have people had side effects like was described by, you know, the other folks on the Zoom tonight? Yeah, people have had it. People have had side effects, you know, afterwards, but that's understandable. Anytime you give somebody a vaccine, they're going to have it. You know, some people have same thing you described with the flu vaccine when they get that. You know, I take that every year and you know, I don't get side effects, but some people do. And you have to realize, okay, if you take this, if you read the thing I had, I was just looking at the paper that I got when I took the Pfizer vaccine. It says you can have this, you can have headaches, you can have chills, you can have muscle aches, you can have fevers, you can have nausea, you can have lost appetite. And they just go down the list of all the things that you can have after you get the vaccine. And they say, please watch out for that, right? Make sure you're well hydrated, you take care of yourself and all that stuff. So those are the things that we know you can have after any vaccine. And we knew that from remember they tested both those vaccines on 45,000 people before they did it. And there was a huge number of people who were underrepresented minorities in that group. So it was pretty well tested beforehand. And all these things they saw were the things that they know are going to happen. So now if you gave it 1 million people and nobody's died, that means it's going to probably be okay, you know, with that. 1 million people have been vaccinated with these 2 vaccines. I mean, and nobody's died. That's a pretty good thing. And
that was the second question. The next question
100
here.
Million.
Oh, I'm sorry.
100 million people, not 1 million, 100 million.
100 million. Yeah, well, write that down. All right. He asked, did Pfizer and Moderna both bypass animal trials and go straight to human experimentation? That's the question. So I don't.
No, so what they do usually is they go from phase 1, phase 2, and phase 3 are the big human trials. So, but you have to pass phase 1 and phase 2 by the FDA safely before you can go to phase 3. And phase 3 is the big human trials. You know, the first 2 things are like, does it work? Does it say what it has to do? Is it, you know, does it do this? And that's small numbers of people with that. And if it's safe, then they get approved to go to phase 2. If that's safe, then they go to phase 3. Phase 3 is where they get the 45,000, 50,000 people in the different groups testing the virus to testing the vaccine to see if it works or not. And that's usually what they do. So, and I know everybody's all nervous because it was fast, but it went through all the hoops it had to go through in order for it to be safe. Right. They did not push it out faster than it had been. You know, the problem is that because there was a lot of doubt from the previous administration, everybody worried that this thing was not done safely, but it was done within the parameters of what we always do for vaccines. It was not rushed. It was done as quickly as it could be done. And it was done pretty fast. I have to say, I'm pretty impressed with the science and how they really did it. Because if you read through the lines, they went the extra mile to figure out stuff. That's why it took longer for Johnson & Johnson, because they had to go through the hoops. They all got to go through the hoops with the Food and Drug Administration.
You need to take a sip of water because you've been going. You good?
I mean, I'm doing fine.
Okay.
Before I started out, I'm good.
I have a question. I have a quick question.
Yes.
So, like, you know, if people, I don't know, I feel like sometimes we don't know all the way, like, what to do. Like, if we get sick, you know, sometimes you do ginger ale, or maybe you're supposed to take ibuprofen. What's the difference between ibuprofen and Advil or NSAIDs, or I don't know. But it's like, what can you do to maybe prevent some of those side effects? Like, do you take D3? Do you stock up on orange juice? Like, what would you recommend so that if we are
You
gonna
have a
get sick,
symptom.
how to kind of heal
There's
faster?
there's a debate about whether or not you should. So first of all, so there's different types of drugs. So one is Tylenol, which is something that we use on. It's pretty safe and it doesn't do much to most people. Then there's non-steroidals, which is Advil, Motrin, Aleve. Those are all non-steroidal drugs. Then there's simple aspirin, and that's another slightly different class of drugs, right? So what happens is those things, when you take them, if you're having symptoms afterwards, will help make you feel better. And what they were trying to say is, well, maybe you shouldn't do, maybe you shouldn't do. But I think the reality is, if you feel miserable, after you've taken the thing, it's probably okay if you take a couple of Tylenol, and then try to rest. That's probably okay. It's not going to affect the effect of the vaccine. So, but they were like, you could blunt the effect of the vaccine. The vaccine's it's making you feel miserable already, right? So you might as well take if you can take a little Tylenol, that's probably okay. If to blunt the response to doing that.
Yeah, because I did hear that. Like my friend wouldn't take any medicine because they thought it might lessen the effects of the vaccine. And I was like, oh no. So I hope you can take some medicine too, Mrs. Stahl. We don't want you feeling
You
horrible.
don't want to hurt yourself, but you
Yeah.
don't want to blunt the
I
vaccine.
did.
I don't know if they're really. I've only heard some people saying just being, what they're saying. I think they were saying with some folks, don't take it prophylactically before you do it, right? But if you certainly feel miserable afterwards, I think it's probably okay to take it. With doing it because they don't want you to sort of, pre-do it because then you don't have any of the fevers or any of the other things that go along with it. But if you're miserable afterwards, it's probably okay.
Thank you.
Here is one. Does injected mRNA genetically alter your body?
No, it does not.
Okay.
The mRNA goes into the cells and then it basically creates the reaction, then it goes away.
All right.
So it does not alter your DNA or RNA.
Since the answer is no, then I don't have to ask the follow-up question because that was based on if it did.
No,
So,
everybody's nervous about that because this is it's a new class of antivirals, so everybody's like nervous about it. But right now, it does not do that. I mean, the mRNA is just a vehicle to introduce the antigen into the cell so that the cell can know that it's been exposed and alter the cell so it doesn't connect to the COVID the SARS-CoV-2 virus.
that answer was no, and I think he's watching, so he's probably saying,
The answer is
"Got
no.
my answer to that." Did Mallory just put one in the chat room? Because I remember I said I want from all.
He would like to know, are there any long-term effects from taking the vaccine? If so, are you aware of any?
All right, so the vaccine, I guess, was just rolled out, and the trial started last summer, and there's not been any long-term effects that I've heard about from the vaccine. So but we only have 8 months, of data on it, right? So right now there's none. Right? There's a lot of information we're collecting related to getting COVID. There are people who are so-called long haulers who basically have symptoms going on for 6 months to a year where they're weak. They have nervous issues. They can't sleep, they can't concentrate, they have cardiac problems. There's all kinds of. If you actually have the COVID-19 infection, if you have the actual COVID disease, right? We know that there's a lot of problems you have, but none of that at all has been identified with the vaccine. The vaccine has so far proved to be totally safe.
Here is a question related to herd immunity. The CDC previously stated that herd immunity would simply occur over time. More recently, they changed their definition and stated that herd immunity would occur once a certain percentage of the population became vaccinated. So my question is, which is correct? And for example, he elaborates, with the Spanish flu of 1919, there was no vaccine. However, eventually herd immunity happened and the flu epidemic passed. Wouldn't the same thing happen in this case without vaccines, especially since the Spanish flu was a lot worse than COVID-19? That's the question and the long statement. And
I don't know if the Spanish flu was worse than COVID-19.
right,
Because remember in 1918, when it happened and it ended in 1920, there were no ICUs, people just dying, right? So, right now we're at 550,000. I think the number is 600,000 to 700,000 people died from Spanish flu. So I don't think you can make a comparison because it's a different era, with it. So I guess the question then is, what is herd immunity? Herd immunity means the herd, that means us. So 80% of people get the infection and they develop natural immunity from that. The problem is that if 80% of us got it, we would have 2 or 3 million people die from the virus. So I mean that means that more, your orders of magnitude more than what we have right now, right? So we have 550,000 unfortunate people who died, and that number goes up 1,000 a day with that. So if we say we cease that and we didn't vaccinate anybody else, and we let the whole natural herd immunity take place, it would take time for it to go through the run rampant, but we'd have a lot of dead people. And the problem is that all the hospitals would get overrun. Remember, we were getting overrun at one point around January. I mean, there was 130,000 people in the hospital, 120,000 people in the hospital, and there were hospitals that are running. Or just think about what happened in New York, where you had the morgues outside the hospitals, where they had refrigerated trucks with deceased remains of patients who died from it. There were hospitals where 40 people were dying a day from this thing. I mean, that's what happens, right? If you had herd immunity with this, that means that every hospital in the whole country would be overrun, and that all of us would get sick and would die from the thing possibly. So that's herd immunity without a vaccine. With the vaccine, you get the herd immunity by vaccinating people up to 80% of the people, and you could do it safely, and you could do it so that the herd, which would be us, gets vaccinated, develop immunity by getting vaccinated. So vaccinated your way to herd immunity is the best way to do things now, and not rely on natural ways to get to herd immunity, because herd immunity naturally is not what we want right now.
thank you. Why were there little to no cases of the flu reported this past winter, which is normally the peak period for flu season, even in states that have had less restrictive measures than California? That's a great question.
That is a great question. So I think people think it's related to the number of masks that people are wearing. And even in some places where there were people wearing masks. So I think I saw the numbers were like minuscule. I mean, it was like in the hundreds across the country. It was really small, the number of the flu. And that's because I think everybody has been, certainly in California, it's less because people here, in the bigger cities comply with the mask, probably the small towns, probably not, right? But the wearing of the mask reduces the incidence of the flu, which is why that number is so low this year.
I think I have asked all the questions on my pieces of paper. You're remarkable. Man, you look, boy, look. I know one thing, they better not cross their
Did
hands.
not break a sweat.
I have no chance. You like, boom, boom.
Tonight. Oh my goodness.
Yeah, well,
It's like a tennis match.
Yeah, you learn how, it's good I mean, everybody has questions. And I think the main thing is we have to try to get to people's worries and their concerns and try to answer them, make sure they know it's safe. And then they see their friends getting it and they'll say, yeah, there may be bumps in the road, but it's relatively safe and it's way better than getting it. And the worst thing in the world is having your family member, how are you, having died in the hospital by, we have to get people on the phone, and the phone basically is the only way that you can even see people, because you can't see people. They have really made it so that you can't see people who are in the hospital who have COVID-19, because what they're trying to do is they're trying to make it safe, for everybody, right? So if you're in the hospital and you have COVID, you cannot essentially go and visit people, right? And that's why we have restricted visitation policies in the hospital, which is quite unfortunate, right? Because people aren't being able to go and see their family. And so they're sick. We have the policy is very restrictive now because you can only have one person maybe go in for a period of time because everybody's really worried about it. I mean, they still have this whole thing. You have to fill out a questionnaire on your phone before you go to the hospital. You got to get, temperature check. I mean, I went to the Apple store today and they're still checking my temperatures and, so I don't know if they really pick up anything when they do that, but it's sort of a way that they're trying to do is screen people to make sure that people aren't running around, sort of spreading the virus. So those are the things that we're doing at the hospital to try to mitigate things. Now, of course, everybody has to wear a mask when you go in. And the thing about what I do is that I walk in and I don't know if somebody has it or not. So I assume that they have it and I don't want to get it. So I still wear 2 masks and a face shield, when I'm in the hospital, even though I'm overkill, I'm doing overkill, right? Because I don't want to be in a situation where I get exposed and stuff. So if you do that, because I'm doing high risk stuff, or I'm doing something high risk, right, then I'm gonna, make sure I protect myself. It's lower risk, you probably don't need to do it as much, anymore. But lower risk stuff, walking around doing stuff. So when I walk around the building, I may not have it. Most people don't have it. But when I'm going to do my work in the emergency department, when I'm doing trauma stuff or doing other stuff, I mean, I still wear 2 masks in the operating room, even though I know people are negative because I'm just kind of being cautious, with doing things. So, once we get to the less numbers, I think it'll be 100% better with that. So I think the bottom line is that there is news on the horizon. There's light at the end of the tunnel. It is getting brighter every day. We're going to vaccinate our way out of this thing, and that people will get back to normal. And the more people we vaccinate, is the better. The people of color, African American, Latino people have been affected 2 or 3 times in terms of more than the white patients in terms of hospitalizations, ICU hospitalizations, deaths, in terms of doing stuff. So what we got to do is you got to make sure this is, yeah, of course my computer's asking me stupid questions when I'm doing stuff. So we'll get back to normal and do things, but it's just gonna take some time. The more we vaccinate, the more we're better. The more we make sure we take care of each other. Even wearing a mask another month or so. I mean, I can't believe that states like Texas and Florida and North Dakota, South Dakota removed the mask mandate, because that's the only way we can actually, that we know that masking works. It reduces viral transmission by 90%. Right. So why are you going to do something that's easy to do? And that's a behavioral thing, right? This is one of my masks. I have multiple masks around here, but it's one of them. So, you put the mask on, right? You protect yourself, protect everybody else, and you do that, for the next month, and maybe, we can go back to normal in the summertime or the fall, where it's better. And that's really what we want to do. We want to get ourselves out of this terrible situation. And I see that it's getting better. Just a number. I mean, a month ago we had 70 people in the hospital who had COVID. Now the number is 65, 70. The number is probably between 1 and 5, and nobody's in the ICU in our hospital, San Francisco General. So that is actually remarkable. That's
I want to make this question in. It came from Canada, by the way, and I think you've already covered this ground, but I want to ask anyway. And I think I know your answer. It says, what measures do you think are actually necessary to prevent deaths while we are waiting for everyone to get vaccinated? And I think you've been answering that question all night. The masks, the social distance. Look, let me be quiet. Let me let you say it, because you're the.
So it's the masking, the hand washing, and social distancing. There was an outbreak in Vancouver among, I think, the Vancouver Canucks hockey team, where 14 teams got it, and then the Mets and the Nationals, there was an outbreak there. And I mean, there's going to be these outbreaks that people, anytime you have large groups of people, moving around. I was worried about the NCAA, and the NCAA, they lost Duke, one of the best teams. They lost them. Today was, it's just been an exciting day today. Our Stanford team won. So
Stanford women won the championship.
That was exciting. They hadn't won in years, and that was pretty exciting. Last night, that was an unbelievable game. I mean, I was like screaming and yelling at the end.
Look, we're going to turn this to a sports show, so don't keep going. That game was
fantastic. I mean, I was just like, oh, they're going to lose, because UCLA looked like they had the game under control. But you see the players on the side wearing masks, and people abiding by the rules, and you abide by the rules. You you're reducing. Now, the thing, Texas is going to go crazy. Texas is going to have normal amounts of people in the stadiums, right? I think that's ridiculous. I think you can't do that right now, right? You can have less people, you can separate them, have pods, whatever. If you have 50,000 people, if you have maybe a quarter or maybe 10,000, and everybody's separated, maybe it's safe to do things, with that. But we're going to have to figure out what's the best way to do it, because we don't want to trigger any upticks in the virus and create an outbreak.
Well, you don't want to start going like this and then
Right.
go
That's
back.
so we're worried about the fourth wave, and the fourth wave is that if what happened in Texas and Florida triggers a fourth wave, that means that those young kids travel back to their houses and their homes, and they infect more people in Michigan. So New York, the numbers are going up. New Jersey numbers are going up. In Michigan, numbers are going up. All right, so our numbers are going down, and that's why we're in the orange tier, and it's less restrictive, and people are doing things. So we're, we don't want to have this fourth wave. So whatever we can do. So anybody who's listening here, what we're trying to do is prevent this fourth wave, right, by just holding on, right, for the next couple of months. You hold on for the next couple of months, then it'll be easier for us to do back to normal stuff, because nobody wants to be at home locked up, right, either cooking or getting takeout food or doing all that stuff, or not going to the movies and or doing all that stuff or socializing with your family. Everybody misses their family. I mean, come on, or your kids not going to school. Let's talk about getting the kids back into school again. I mean, I always get back to that. Getting the kids.
Yeah, I just talked to my sister about that. The Marshalls getting together, and she said, "Well, we had to talk about it because we've only seen each other on Zoom since last March." Do you have any thoughts about schools and how they should be? And again, that's not. Look, I'm asking. You're not the superintendent of schools, but in any of that. But just do you have any thoughts about how?
Yeah, I have some thoughts, and I'll just sort of say the first thing is that if we have a choice between bars and schools, right, we got to choose the schools, right, because these kids are a year behind.
Like
right?
that. Choice between bars and schools.
Bars and schools, right? You got to choose the schools. And how do you get back to the schools? And the CDC has recommendations about the distancing, proper ventilation, making sure you clean things up. There's actually money in the COVID Act that was just passed by the Biden administration to give to schools to make sure that they can keep things clean. They wash the surfaces down. The kids wear masks. They separate themselves. Those kind of things. There's an option now. You can either stay at home or you can come to school and do that. They're starting in California by doing the K through 8 grades, because it seems like in the K through 8 grades it's a little bit safer to do that. But there's still tremendous controversy. I mean, to me, it was a no-brainer to vaccinate all the teachers a long time ago. Teachers should have us. They vaccinated the healthcare workers up front. The teachers and essential workers, we all should have been vaccinated together. Teachers, bus drivers, people run the Muni, the BART, they should all get vaccinated, because they're all high risk and exposure. So vaccinate all those people, vaccinate the people, the teachers, so the teachers don't have to worry. The teachers are worried that they're going to die, right, if they go to school, and there were teachers who were dying. So let's vaccinate the teachers, make sure they're okay, right? Once we do that, then we could then start opening up the schools and do it in gradations and slowly, and see what happens. And you're going to have to follow things and test kids. There's a couple of school systems that they were testing kids a lot, and so you have to test them fairly regularly to make sure. And there's this saliva test, and for those of you who had the test of COVID, it's not a lot of fun. I mean, I don't know if you've has anybody had the COVID test yet? Have you?
Malcolm did, but I didn't get the COVID test. No.
So the COVID test, the swab test is not very pleasant, right? They go up in your nose and they 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and your ears, your eyes tear, and it's not very pleasant, right? So, but they actually have other ways to do it now, where they want to get your saliva and they can test that, and maybe they do a nasal swab that's not so traumatizing for these poor kids. So, but you got to test them regularly. So the other thing that's problem is going on is that the number of tests that we're doing is actually going down, right? So we need to be continued vigilance by testing more people. So the test to get kids back to school is testing them to make sure that they go in. Oh, look at that. There's a cutie over there. All right, how are you? I know they're like, how are you? Good evening. You want mom's attention. I know that we're taking too much of our attention there.
That's Ann's mini me. That's Evelyn.
So you have to make sure you test the kids, you vaccinate the teachers, right, and you watch out for and you sort of have groups of pods of kids that sort of travel together, and so you have to have restrictions on the way they move around and do things, and getting back to opening up athletics, that's always the toughest one. But you're gonna have to make sure you test them, you follow them, they wear masks when they can, so all these things are things that we should be doing. We should really focus on the schools, because these kids are now a year behind, because sitting there, and I mean, if you're think about this, you're a first, second, third grade kindergarten, and you have to sit in front of this screen and watch this screen like all day. I mean,
Yeah.
that's terrible. I mean, that's not the way
Yeah.
kids learn. They don't
Yeah.
learn that way. And that's so we have a generation now of kids who have been traumatized by Zoom, right? They don't want to go to Zoom. I mean, why you want to sit in front? I mean, how could you sit in front of a thing? You're a kid.
And I think there's one last one in the chat, right? One last one in the chat, and then I'm gonna ask the hardest question of all. And then go ahead.
Well, I think people are still reluctant. And Mallory asks, what would you say to people who are reluctant and don't trust the vaccine?
Right. Yeah.
So let's talk about that. So among the African American and Latino community in the United States, there's a lot of distrust about vaccination based on history of people not having adequate access to treatment. So whether or not it's treatment for cancer, treatment for brain tumors, vascular disease, right, or whatever with that, or then people talking about the horrible study of the Tuskegee airmen where they were not treated. So all these folks there's a lot of doubt. So initially, I know people were very, very concerned, because they're like, well, we weren't treated the right way. Why is this any different? And I don't want to be experimented on. So the fact is that the drugs are safe, right? You can take them without any problem. And you have to just sort of say, all right, well, I need to take a leap of faith so that we can get out of this thing, right? So that we need to agree that in order for all of us to get out of this thing, that we need to trust the science, and the science is there. I mean, so if I told a Black patient that a Black woman helped develop one of the Moderna virus that Dr. Marshall got, right now, she has no problems with African American. She's Black, right? And she helped develop the vaccine, and the vaccine is safe. Either Moderna, Pfizer, or Johnson & Johnson's safe. And we got to reassure people, saying that it is safe. It is something that we all should do, and let's move forward, by doing this, right? And that, if you get a chance to do it in your neighborhood, go and do it. I mean, they're opening up these huge vaccination. They have one in the Bayview at the Market Center over there. Moscone, they have one at City College also. So you can go to mass vaccination centers if you do it, and just get in line and get the vaccine and just be done with it. And I think that's what you really want to have. You want to get past this thing. So, and the way we get past it is by trusting the science. The science is there. You can trust it, and it is safe to do. So that even though you have distrust and you worry about it, and people are like, well, maybe I'll wait now. Okay, now 100 million people have been vaccinated, right? What you waiting for, right? 100 million people, right? What are you going to wait for, right? You want just join the group, and you'll be part of the 200 million people, right? So you don't want to wait for you to get sick, right? And that's the problem.
You said it all. You said it all. You are a marvel. You are a wonder, but mostly you're a doctor. And that's what doctors do, is trying to save people's lives. Thank you, man. Thank you. This whole thing is a snapshot in time. I'm sure we'll have you back as we, and actually, since we've been doing this, I think it's the third time now that we've done this just on this.
Happy to come back anytime, that.
Yeah, so. The fact that we're here, that we're making progress, that, is great. It's great. And just thank you for, thank you for being you, man. Seriously, thank you for being you. That's it's so much. Bree, you want to say something?
It's a quick question. It's a very quick question. So I'm actually looking up trying to get the vaccine. I was very hesitant about it, but just listening to you and, speaking about it, like my health comes first, and, I do not want to get COVID and all of that. I was looking up like other clinics where to get the like to set up appointment. I've seen a lot at like CVS and Safeway and Rite Aid. Is that still the same thing?
Yeah,
Like,
they're trying to roll it out even more. They have the big centers, and then they have, they have Walgreens, they have
Mhm.
CVS, and they have a line. So I think the 15th, if you're over 16, I don't know, I'm not going to ask how old you are, but you look like a youngster, right? So that's a good thing, right? So,
I'm
so if
24.
you're over
Oh,
16,
don't tell her that. She loved that. Good.
right? If you're on the 15th, right now, I think it's over 55, you can get in line. And if you're over, and on the 15th, if you're over 15, you can get it. And I think then after the 30th, at the 1st of May, anybody could get it.
Okay.
Who's anybody in the whole United States can get it because they have enough. I think that they have somewhere between 300, 400 million doses of vaccine that are available. So you have to get on. It is from what I understand, it is tedious to do it, right? So I mean, I was fortunate because I'm a healthcare worker and I get it. There's a lot of people who have it around me, so I got to like get it. So I got it early on, and they called me. They told me when to get it and all that. So now you may have to, call the Walgreens in your neighborhood, see what the waiting list is for Moscone or for City College or for the one in the Bayview, right, where you go and just sort of see where you can get it. If you live in Oakland, there's Emoji or you I've forgotten the name of it, but it's a traveling place where you can actually get it. There are churches now that are giving it. So you want to see, just go online and look to see where it's available. But they're trying to get it to every single drugstores. I mean, the whole idea that the president said is that he wanted to try to make it within 5 miles where everybody lives. Right, so we could do that.
Wow.
Pretty much, that's what the goal is.
Wow.
With all the money, the $3 trillion or $2.9 trillion thing package was sort of to get it so that everybody can get it, so nobody's struggling because people were trying to call in. They're getting busy signals. Everybody's getting frustrated, which is terrible.
Okay. Thank you.
No problem.
Thanks.
Thanks,
Thank you.
I appreciate
Let's
it.
give him the big hand, man. Put the big hand up, or the one that you do in the on the screen. Yeah, do one of those Lady Estelle hands, because I ain't no. There it is.
Give you a thumbs,
Oh, you got it
thumbs
too.
up. No, I could give that. Here we go. I got the
Thank
applause.
See you soon, man. Much love. Thank you very much. All right.
Thank you so much.
See
For
you
having me.
soon. We'll
Appreciate
keep you. Yeah. All right. Good night. Thank
Yeah.
you so much.